Thanks very much indeed for joining us. Welcome to the program.
Thank you so much. Great to be with you tonight.
All right, so innovation. I mean, that's such a big word. And when we talk about innovation in medicine, what are we expecting?
Well, innovation really is the key word here, and really a pioneering partnership for USAID. As you mentioned in the preceding spot, this is our first ever subnational level G2G, government-to-government agreement with USAID, and in this case, as you mentioned, with the Western Cape. Typically, AID does a lot of work with nonprofit organizations, non-governmental organizations. In this case, it's government-to-government, really building on local systems, subnational systems, life-saving quality health care with access and equity really fundamental.
So who drives the innovation? Are you just funders, or do you come with expertise as well?
Well, we really come with an orientation of partnership. So impressed today by just the partnership that we have with the Department of Health here in the Western Cape. Met, of course, with the Premier, also with the MEC, the directors in the department. Just people, obviously, with such significant expertise. So we're really supporting their capacity, supporting their teams, building again on their systems and delivery, and really helping to deepen and to strengthen access to quality health care in the Western Cape. So it's really building on their capacities, their expertise, giving them that surge of support.
All right, so what you're suggesting is that the innovative ideas are there, they just haven't had the abilities to be birthed because of resources.
I think resources indeed is a constraint, but really commend the department here. So impressed that the department is investing considerable resources, significantly more than USAID is bringing to the table, and we feel that's an important consideration for us. That's to say the Western Cape has significant resources invested already. We are coming in to increase those resources, to increase access, to increase quality of service delivery, both at the level of, you had mentioned, the e-lockers is one innovation. Also telemedicine, really increasing improved communication exchange with clients and professional healthcare providers.
All right. So have you rolled this out anywhere else in the world? And what kind of results have you seen? Or is this a pilot almost?
Well, we do government-to-government support in other countries, but I should say it really depends on the capacities, the will of our government partners. We've been, again, really impressed. We've been at this for over a year now in preparation of this partnership with the Western Cape, working to support financial controls, systems, so that we can ensure that the resources are used for intended purposes. So we've had a lot of preparatory work. We feel really confident going into this, and again, and especially because of the partnership, the relationships so positive that we've built.
So why the Western Cape?
Well, this, I should say, is a motto we look to replicate absolutely in other parts of the country. So we see this to be just our first entry point, but absolutely we're looking to scale it up and to use it as a model for replication moving ahead. So I'm very confident that this will not be the last province that we'll be working in directly, and will indeed be scaling this out and diversifying partnerships along these lines.
And has this come with the blessing of the national department? Are they quite happy for you to go provincially?
Absolutely. We've been in very good consultation at the national level. And again, what we're doing at the subnational level is absolutely strategically within the framework of national priorities. That's key, is that when USAID is engaging, we're working within host country frameworks, within the priorities as expressed at the national foremost and the subnational level. So very good communication all around.
So why tuberculosis, HIV, and I guess COVID-19 is an obvious one in the current scenario, but I see the focus on tuberculosis and HIV as well.
Absolutely. As you know, and listeners will have heard of the PEPFAR program. This is the U.S. President's emergency initiative really focused on combating HIV/AIDS. And we know with the burden of tuberculosis here in South Africa and the tandem effect and the relationship of HIV/AIDS, tuberculosis, and indeed COVID-19. So we're really looking to address these three pandemics in a very coordinated, systematic way.
So with this kind of partnership, I mean, is it fair to say that a number of lives are being saved, quite literally?
Well, we think absolutely in South Africa that lives have been saved, absolutely, since the inception of PEPFAR more than 15 years ago. But we believe there's much work to be done, as we know, in terms of COVID-19 as well, increasing the number of vaccines, really building the demand for the vaccines, a lot of behavior change communication, a lot of work in particularly marginalized communities to really give people the confidence to pursue vaccinations. We believe that's so important. So important work to be done. We believe this is a really good approach. Again, using at the subnational level from healthcare community workers that have the trust of those communities, work in facilities, but really community outreach prevention being a key part of our interventions.
We heard in that package that you've built a relationship with the Western Cape over quite some time now. What are some of the challenges that they share with you that they need help with particularly?
Well, you know, I've just been here for a few days in the Western Cape. It's actually my first visit, but I'm so deeply impressed by just the diversity in the region, socially, economically. So obviously different segments need different types of intervention, particularly among youth. So tomorrow I know I'll have a chance to get out more and more, see some of the engagement that we're doing in different communities. So I think we really need to adapt our interventions to the needs of specific communities, really focusing on youth quite a bit.
What are you looking forward to in terms of COVID-19 and innovations there? Because one gets a sense people are starting to feel as if the pandemic is behind us, but it really isn't.
No, it really, truly is not. And we're encouraging everybody, please, to be vaccinated, to protect yourselves, your loved ones. Speaking to a lot of the professionals this evening, certainly a sense that we're not at all out of the woods yet. We've heard of another wave on the horizon, and really preparing, getting those shots into those arms is going to be absolutely vital. So really building that demand for services, getting people really educated in terms of the implications is very important. So I think a lot of engagement, a lot of work in education, and a lot of work at the community level will be key.
When do you think you'll start moving to other provinces?
I'm sorry, could you repeat that?
When do you think you might start to scale up this partnership with other provinces?
I think in the year ahead, that there's very important work already underway. As you know, with the U.S. government, we have a very strong interagency, of course, USAID in this case, also CDC. So really an array of agencies all working in coordination. I'm quite confident that you'll see additional models just like this one in this coming year, just around the corner.
All right. And what about neighboring states in the region?
A lot of important work taking place. I'm coming most recently from 4 years myself in not a bordering state, but one in the SADC zone, and that would be Tanzania. So I can tell you from experience there, a lot of important lessons learned, but one thing that really distinguishes South Africa is the fact that we can work government to government. It's not something that we're able to do in countries throughout the region. It really takes a good partnership where there are good systems in place, where there's confidence, and where there's mutual respect. We're really working very transparently and really putting, as you mentioned in that piece at the start, really dignity, patient dignity, so important in healthcare. If we're going to build the trust of our clients, if we're going to build trusting relationships, it really needs to start with transparency, solid mutual understanding to see the results we're after.
Andy Karras, I want to leave it there. Thank you so much indeed for joining us, and thank you so much indeed for the efforts that you're putting into and investing in our country. Thank you.
Thank you very much. Pleasure to be with you.